Hi, everyone. On today's podcast, we're going to talk with Gina and Roxanne, the sister duo behind Mamaste Fit, about the importance of health and fitness during pregnancy.
Welcome to the Evidence-Based Birth Podcast. My name is Rebecca Decker, and I'm a nurse with my PhD and the founder of Evidence-Based Birth. Join me each week as we work together to get evidence-based information into the hands of families and professionals around the world. As a reminder, this information is not medical advice. See evbirth.com/disclaimer for more details.
Hi, everyone. My name is Rebecca Decker, and I'll be your host for today's episode. Before we get started with today's episode, if there are any content or trigger warnings, they'll be detailed in the show notes for this episode. And now I'd like to introduce our honored guests. Gina Conley and Roxanne Albert are the sister duo of Mamaste Fit. Together, they offer childbirth education, specializing in labor and pelvic biomechanics, and pre- and postnatal fitness programming. Gina, pronouns she, her, has her master's in exercise science, runs the Mamaste Fit in-person perinatal fitness training facility in Aberdeen, North Carolina, and supports families as a birth doula. Roxanne, pronouns she, her, is a labor and delivery nurse, recently serving as a birth assistant in a freestanding birth center and is now a student midwife. Gina and Roxanne are located in North Carolina, U.S., where you can train and learn with them in person at their Mamaste Fit facility in Aberdeen, North Carolina, or you can join them from all over the world online with their Mamaste Fit Instagram account and their online classes. I'm so thrilled that both Gina and Roxanne are here to talk about their work. Welcome to the Evidence-Based Birth Podcast.
Thank you for having us. We're so excited to be here.
So, Gina and Roxanne, can you tell us each what inspired you both to go into birth work? And when you introduce yourself, just let us know who's speaking it first so that our guests can learn your voices.
So my name is Gina. I actually never imagined myself being in the birth world. Had it like 10 years ago when I was still in the Army. So I was active duty Army and transitioned off of active duty into the civilian sector after my daughter was born. So I essentially was leaving a full-time career to become a stay-at-home mom. As I was navigating this like early part of postpartum and motherhood and trying to like figure out my new identity, I founded Mamaste Fit with the help of like some friends and family. And we started like our prenatal and postpartum training facility. And after about a year of training people in person, we started doing these like birth prep workouts. And the birth prep workout was like a 10 to 15 second like cardio output. So something to get the heart rate up, get the respiration rate up. So essentially like exercise-induced stress. And then we would spend like 1 to 2 minutes relaxing in a labor position, trying different comfort techniques, using different relaxation techniques. And so it was essentially like practicing for birth. And so we're using this little bursts of exercise to create like a simulated contraction essentially. And I would encourage like the partners to come and do these workouts with them. And one of my prenatal clients, her husband was doing the massage technique and it just wasn't the same as me. And so she kind of like pushed him off of her and was like, Gina, I need you to be my doula. And so we had our perinatal training facility and then we expanded to birth support about a year after starting the gym. And it makes like total sense kind of where we've come with Mamaste Fit, even from being in the Army and then moving into this like what felt like a really different environment. It was still pretty similar because the biggest roles that I played in the Army were all about supporting women and supporting other people within this perinatal timeframe. And so it made sense that after I got out of the Army, I eventually just kind of took on another role that was supporting women and folks within this phase of life. And it was just like in a little bit different of a way. So it was pretty interesting to come into the birth world.
Have you always been into fitness and exercise? And what gave you the idea to use exercise to simulate contractions for like rehearsing labor?
So I've definitely always been into like working out. Like we're both Roxanne and I were collegiate runners or I guess in college, that's what collegiate means. But we ran in high school. We've always been like really into sports throughout our lives. And so I was definitely more into the fitness aspect. I had never taken like a personal training program or really understood like how to write programs until after I left the Army and got my bachelor and master's in exercise science and took some personal training certification courses. But it was always something that made a lot of sense to me. And like I was really passionate about was like helping folks with kind of their physical fitness. And so the prenatal workout or programming that we had established at first was definitely very much about keeping somebody in shape throughout their pregnancy to support their labor, ensuring that they were comfortable throughout their pregnancies. And it was definitely a lot of movements that were quote unquote like safe for pregnancy. And a few months after training clients, I realized that our prenatal programs needed to be more than just safe prenatal exercises and like strength training throughout pregnancy. It needed to be something that was also going to prepare somebody for their birth. And our programs now have really expanded on that a whole lot more. I mean, after doing it for like 5 or 6 years, you learn some things, but I wanted to incorporate something that was going to help my clients actually prepare for their labors. And so that's where we came up with this birth prep workout. And so I wanted something that was going to help them practice labor positions and comfort techniques. And the way that we figured out doing it was to have this like quick burst of exercise to get them tired and create this exercise-induced stress to where they can then focus on relaxing and figuring out what positions they felt most comfortable in, which positions they felt like they can relax more easily into, which comfort techniques they really liked. So it was kind of like a rehearsal essentially before their labor. And we got a lot of really good feedback from our clients that it was really helpful for them because they knew what positions felt best for them. Their partners knew like what comfort techniques to do in different types of positions. And so it just ended up making a lot of sense.
Almost creating a bit of like brain or muscle memory so that when you go into labor, you can quickly relax in between contractions and get the most rest possible.
Absolutely.
Yeah. And Roxanne, tell us your story. How did you get into birth work?
So it was during nursing school. I think I was just mostly interested in like the maternal health portion of the curriculum. I thought that like I was in college and nursing school intending to go into the army. So I was like, oh, like you're going to be an army nurse. That's like everyone thinks of like trauma nursing or like intensive care nursing. So I was like kind of dead set, like, oh, I'll just be an ICU nurse. But I like always had this, I feel like calling towards like maternal health, I guess, in a way. Like that was always like something that intrigued me. So in nursing school, I did my capstone, like at the end, the last semester, you do like 3 to 6 months of just working on a unit. So I was like, I'll just do an ICU because maybe I'll just do it and I'll absolutely hate it. And it was interesting. It was definitely like using my brain in a different way. But I was like, this is not something that I feel like pulled to. Because I had done, the Army sends you to like kind of the similar thing, like a capstone for a month during the summer between your junior and senior year. And so I did labor and delivery for that portion so I could try both of them. I was so excited to go to like clinicals every day. And it just like really excited me to be able to support people during labor and birth. And it was, I mean, it's like an exciting time, like 99% of the time in birth working when you go to work. It's like people are meeting their babies and like changing their families. So I liked that aspect as well. And then just after I got out, we started in postpartum, which I loved postpartum because it was all about the education, but I still just had this calling to go to labor and delivery and kind of like go to the birth side. And then I loved being at the freestanding birth center because that was like a completely different experience there. So now I'm just like super obsessed with just birth in hospital and out of hospital and like making it as similar as possible.
Mm-hmm.
If that makes sense.
And did you two have your own birth stories? And if so, how did they intertwine?
So this is Gina. For me, I've had 3 births now. My first one was a hospital birth. I was sort of induced. I got Pitocin at some point to augment my labor, and then I had an epidural. But ultimately, the thing that really affected that birth for me was not feeling very supported by the midwife that I had and kind of the nurse that I had. And it like definitely affected how like we created Mamastefit, and was kind of using Mamastefit at the beginning to kind of help heal myself, to help other people have better birth experiences, to have better pregnancies. Then my 2 following births were both home births, and they were completely different experiences. Not that being at home was necessarily the better aspect, but the provider that I chose to support my 2 subsequent births just was so much more what I needed. And like, I felt heard, I felt respected throughout my experience. I felt like everyone there like truly believed in me and my ability to have the type of birth that I was wanting. And then I also trusted them that if I did need any sort of intervention, that they were doing it with my best interest in mind, as opposed to they were annoyed with me or I was being inconvenient for them. And so for me, my first birth, I felt really unsupported. And then my next 2, I felt so much more supported. And it was also Roxanne's introduction to supporting birth that was with like a family member. So all of her previous births had been with patients. And so my birth was her first one as like this, with this emotional connection to somebody. And so we both started to realize that there was a lot more to birth than just this is what a contraction is. This is like a comfort technique to do. There's so many more aspects to it that were really important to help educate other folks on and help them prepare for their own births.
So Roxanne, what was it like to be at Gina's births? Were you at a home birth or the hospital birth? When were you supporting her?
So I was at all three of her births. The first one was at the hospital. I had just moved from Tennessee to North Carolina. We were really excited that Gina was still pregnant when I got there, but I was like, it was so weird being like not the nurse, if that makes sense, being like on the supportive side, because I felt so confused the entire time about what was happening. But she also had hired a doula. So I'm like, well, I don't want to like step on any toes. So I'm like, this must be what it feels like to be family members when people do not explain anything that is happening. And then also, it's really hard to support family during labor when they are yelling at you or like things aren't going right, because you just want everything to go perfectly for them. Especially like as a nurse, I just wanted her to have this amazing birth. But I had zero idea how to do that, if that makes sense. I had been a labor nurse for like 2.5 years at this point. So not super experienced, like still early on in my labor experience. But like, I mean, I've been at a ton of births at this point. So I felt like I was like going to walk in there and know exactly what to do. But it was a different hospital. Like I didn't know how they run things. I didn't know any of the nurses or the doctors or midwives or anything. So it was very weird walking into her labor because she went to the hospital against my advice. And it's really hard when it's your older sister. I think it's different when Gina kind of supported me because like she's my older sister. I'll listen to anything she says, regardless if I don't really want to do it. But like as the younger sister, it's like a different dynamic too. So like I'm telling Gina like, hey, your contraction started 1 hour ago. You probably don't need to go to the hospital. And she's like, nope, I'm going. And I'm like, I think you should, I think based on the way that you're talking to me on this phone, you probably should stay home. But it's hard to be like, no, you need to stay home. Like, I'm going to come over and we're just going to like nap together, which probably like in hindsight might have been the thing that she needed. She didn't need her younger sister. She just needed like more like, hey, this is what benefits you because you're still in early labor, like early labor. So it was just like a weird dynamic. And then I've also like doulaed for another close friend. And it's still weird to me to be like a labor support instead of like the medical person. Like I always will like revert because that's like my muscle memory in a way to like look at the monitor to make sure baby's doing well and looking at all of the other medical things that we look at with birth, but also remembering to look at the birthing person because they're really the best key of what's going on. And I didn't know that with Gina's birth. So that was just really weird to be a part of. But I feel like I've improved hopefully a lot as a labor nurse since then. Especially like with my birth, like Gina was able to support me and we learned we have very similar labors. And so we learned kind of what we need to do for our bodies after both of our first births. I wish I could do home births, but.
I was going to say, when you went to Gina's home births, how did that compare to the first time?
Oh, it was like incredibly different. I mean, she was way more relaxed and we all understood what was happening because the midwife would like give us updates of be like, oh, like this is what Gina's doing right now. So it wasn't just like Gina knew exactly what was kind of happening in her body. She understood birth a lot more, but also like we felt up to date and aware of what was happening more. Whereas with her first, like we literally got to the hospital thinking Gina was in labor because that's what the midwife had told them that they were being admitted because she's in labor, but it was not really the case at all. So we were just very confused. Whereas at her home birth, it was a very calm environment. And like everyone was really happy and excited to be there, but also like, what's the word I'm looking for? Everyone was like on the same page of what was happening, if that makes sense.
And what about your own birth experiences then when you had babies?
So my husband is not for home birth. He's like, we should just go to a hospital. And I'm totally for that too, because I feel like I being a labor nurse, I understand that things can happen out of nowhere. And I think that just freaks me out a little bit. So I would just never go into labor, I feel like, because of the stress of the what ifs. Like I would love to not have to drive to the hospital, but I got over that fear. So we did do hospital births for my first, but I was also active duty. So it's like it's near impossible to like not deliver at the hospital. You have to get like a ton of waivers. And I worked there, so it wasn't that bad. Like I had my one midwife who I've worked with for the past 3 years. She was my midwife. She came in for the birth during her lunch hour because I just happened to deliver at lunch, which was really convenient for her. So I had like one of my friends who was my nurse, and then I had my midwife who I'd saw my whole pregnancy come up for the birth. So it was just like the perfect kind of situation. And I felt supported my entire pregnancy because everyone knew like I wanted to go unmedicated. Like I wanted to try to not have any interventions if possible. And everyone was like, yeah, like whatever you want. We'll do whatever you want, Roxanne, whenever you come in. If you want to pick your nurse, when you get here, go for it. But they were super full when I got there. So I didn't necessarily have to choose, but which honestly would have stressed me out a little bit. But the hospital, I felt super supportive because I think that I worked there, so I knew everybody, and then everyone was super supportive of me. And then I knew I had Gina on my side. My mom came to my birth. So like my hospital experience was a lot different than Gina's because I think that I had this really supportive team. And then for my second birth, we had just moved to California, like in the middle of my pregnancy. In California, freestanding birth centers, I feel like are a lot easier to find. And there just happened to be one like 5 minutes down the road from the house that we were moving into. So of course I was like, I've always wanted to deliver at a freestanding birth center. This was like the dream because it was the perfect medium, I feel like, between home birth and hospital birth, where it still feels like home, and the room felt like just like the nicest little like Airbnb, but they still had resuscitative measures. Like they had the warmer, they could do PPV and CPAP, and they had medicines if I needed it. So that just made me feel more reassured. And it was the most amazing experience at the birth center. I knew that they believed in my ability to birth and go into labor naturally, and like they didn't push anything on me that I didn't want to do. I didn't even get a vaginal exam when I arrived. They just believed that I knew that I was in active labor, which was really cool. And then I birthed in the tub, which unfortunately I can't. I am pregnant again with baby number 3, and we are going to a hospital this time, and they don't do water births, which I am sad about. But the water birth experience was just super cool to experience in general. So we have different birth experiences where we delivered were different. So Gina was at home in a hospital and I was at home in a birth center. But I feel like the basis of the birth after Gina's first was like we felt very supported and that people believed in our abilities and our bodies. And if we had an opinion on anything, everyone was very supportive of our opinions.
And so it sounds like you all, in addition to all your education, you had a lot of really valuable life experiences with your own pregnancies and birth experiences and sharing those as sisters and family members. And how does that play into what you do at Mamaste Fit? Can you tell us about the different ways you're supporting both pregnant families and professionals?
So we definitely offer a lot with like our Instagram page and our blog because we want to make sure that the education and kind of our expertise is accessible to all, regardless of whether somebody ever buys one of our courses. We have plenty of people that'll DM us and be like, I never bought anything from you, but I religiously followed your page and I had an amazing birth. And that by itself makes it all worth it to us. But we also do have a lot of online in-person offerings as well. So we have our in-person training facility here in Aberdeen, North Carolina. We exclusively train prenatal and postpartum fitness clients. And then we also offer childbirth education in person and then birth support. After COVID happened, our gym was shut down for like several months. And so it gave us this great opportunity to make like tons of online courses. So now we have online childbirth education courses that we also offer virtually via Zoom for folks that don't have an in-person option in their area or they just feel really passionate about learning from us. And so our courses are really focused on teaching the science of birth because we want you to understand what is actually happening because it makes birth so much less mysterious. I tend to find that we're afraid of things that we don't understand. And so helping our clients and our students actually know why they're having contraction, like what is happening when they move their body in a specific way, makes it a lot less mysterious for them and helps them feel a lot more confident and empowered during their births. And so our childbirth education course is really focused on helping you understand pelvic mechanics, like how the pelvis actually opens, what kind of movements will do that, and then teaching the science behind laboring positions and pushing and helping you understand what all of your birth options are in a fairly unbiased way. Obviously, we all have like some bias, but we want people to understand that you can pick anything to support your birth and it doesn't matter to us. Like as long as it was the best decision for you and your family, it doesn't have to be the same that I would choose for myself personally, because what I would choose personally is not the best for everybody. And you can see just between Roxanne and I, like I chose to give birth at home, but giving birth at home is not the best option for her. Like, it's not the best for her mental sanity during her labor. And so it's okay to pick different things in us. And we want folks to know what all of their options are and the risks and benefits as best we can of those options. And then how to talk to your provider about these different interventions and options that are available to you. So you understand kind of what your provider's recommendations are. Like, why is this your provider's recommendation? What other options do you have? Because it's more important for folks to be able to make their own decision without being afraid. And so that was something that really affected me for my first pregnancy and first birth. Was I took a childbirth education course, and it helped me understand that I had options that I didn't even realize that I did, but it did it in a way that was really biased towards the don't take any medicine, don't go to the hospital, end of the spectrum. And it made me really afraid of intervention. And so when my provider started offering interventions to me, I didn't know how to ask questions. I didn't understand how to have an informed conversation on my care. And I was ultimately really afraid of the intervention and didn't understand that there could be benefits to it. In that situation, did I still need it? Probably not. But had I been more informed on both the risks and benefits and what situations it could be helpful in, it's not an all or none, I would have been a lot calmer going into that birth, and it might have completely changed the experience for me as well. So for us, it's really important in our childbirth education course that folks understand what all their options are as best as we can explain them, understanding the risks and benefits, and then knowing how to ask questions to make the best decision for them, regardless of what anyone else is doing. And we try to share that on our Instagram page as well, all sorts of different types of births. And then we also offer prenatal and postpartum fitness programs, both in person at our gym in Aberdeen, and then online for folks that either can't come to our gym or don't live near us. In our programs, we have an app-based program where it's a list of exercise with demo videos. And we also just have a mini program as well, which is 15 to 20 minute workouts. Our longer program is 45 to 75, and it's definitely designed for the athlete in mind. So I wrote the programs thinking about somebody like me who likes to work out. And so creating a program for the type of person that I am that likes to go to the gym and has an hour to work out was really important, because a lot of the prenatal programs that I was finding during my first pregnancy were kind of lacking in the challenge. It was a lot of breathing and yoga and gentle movement, which is important and something that we've incorporated into our programming as well. But it also has the squats and the deadlifts and the hip thrusts and the lifting of the weights and doing it in a way that's helpful for you throughout your pregnancy. And then we also have our full-length workout videos that you can follow and work out and work out at the same time, because we began to realize that everyone is not like me and they would like to work out in different types of ways. So we have our short program for folks that don't have that much time, our longer program for folks who have a lot of time and really like to be in the gym. And then we have our video program for folks to follow throughout their pregnancy. And all of them have the same type of programming style where it's going to support your comfort throughout your pregnancy, keep you strong throughout your pregnancy, because both of those are really important. It's not all about birth. We also want to spend our 9 to 10 months pregnant comfortable and pain-free. And then we're also incorporating movements within our programmings to support you relaxing and connecting with your pelvic floor, helping you find internal rotation so you can open each pelvic level, because things that contribute towards labor stalls could be your inability to open your pelvis because of common movement tendencies and postural habits that we have during pregnancy and due to our current modern lifestyle. So we're incorporating all that stuff within our program to keep you comfortable throughout your pregnancy, keep you pain-free, keep you strong, and then also help you prepare for birth. And then we also offer our postpartum programs as well in a similar format. We have the short programs, the longer ones, and then the on-demand too. For the professionals, we do have online courses, but our focus is definitely the expected family.
And I saw on your website, I love how the videos change depending on where you are in your pregnancy. They can sync up
Yes.
with which week you are.
So our app-based program syncs to your current week of pregnancy. And so the modifications kind of begin to adjust as we shift through the first, the second, and the third trimester. And there's a little bit of leeway within it as well, because even between my own pregnancies, I found that I needed certain modifications at different points. And so it's kind of between these 4 weeks, you might want to do this modification. Or it's the whole trimester. These are kind of the general modifications that we find, but then there's options for each of them. Because we train in-person clients, I'm able to see how other people navigate their pregnancies and kind of the modifications that they need to take beyond my own body. because my body is just the one, and there's so many different types of bodies out there and so many different types of experiences. So knowing all sorts of different ways to modify, knowing when the majority of people begin to need a certain modification has really allowed us to create this really in-depth program. For the on-demand videos, it's per trimester because, again, each trimester has general modifications required and certain things that we need. And so we've created these programs based on where you are within your pregnancy. And then for postpartum, like what type of sport you're trying to get back to, because there's so many of us that have so many different needs. And so we've tried our best to create all the programs to support all sorts of different types of folks throughout this phase of life.
And Gina and Roxanne, I'm really excited to pick your brain with this next question because I know research shows that exercise in general improves childbirth outcomes. And we don't know exactly why. I don't think research has really teased out exactly why, but could you give us like your top 3 tips or ways you could use exercise in pregnancy to either prepare for birth or to prevent like pelvic floor issues?
So for why exercise seems to help with labor, the biggest thing that I think is because you can maintain an upright position longer, it applies baby head to your cervix more, which helps with that like feedback loop of like the labor hormones. So that's why I think exercise helps with labor specifically. And there's a whole bunch of other stuff to it as well. But the top 3 things that I would say for using exercise in pregnancy to prepare for birth and prevent pelvic floor issues would be 1, ensuring that your prenatal workouts include all sorts of different type of movements that open each level of the pelvis. And so this is going to include external rotation with both legs. So like squat type movements where the knees are moving outwards, internal rotation with both legs, and then also asymmetrical movements. So we need the hips to be moving in all sorts of different ways in order to create space in the different pelvic levels. And then we also have to include like thoracic mobility and rotation, because the way that our rib cage is set up can also influence how we can open our pelvis. So you can be doing all of the hip movements, but if your thoracic spine is in extension, it's going to really limit your ability to find that good internal rotation without compensation, which is what is going to open the bottom half of the pelvis. So within our prenatal program, we incorporate all that stuff for you. If in case anyone's like super overwhelmed and they don't know what to do, like we've got you. The next thing in regards to like pelvic floor preparation is we want to ensure that we can both lengthen and contract the pelvic floor. So Kegels are pelvic floor activation or contraction or shortening of the pelvic floor, but we need to be able to do so much more than just tighten our pelvic floor. And most importantly, the pelvic floor does not push your baby out. Because that's sometimes why I'll see folks say like do all the Kegels is to have a really strong pelvic floor so that you can push your baby out. And then when I'm like, well, your uterus pushes your baby out, not your pelvic floor, they're like, oh, no, I mean, it makes your pelvic floor really strong so you can heal better postpartum. And so it's important to understand that strength is not defined by a single range of, or a single point in the range of motion. So being super tight is actually a state of weakness. So being on either end range of motion is a state of weakness, just like being too long would be a state of weakness. And so we need the pelvic floor to be able to move through its full range of motion, which includes the contraction, the relaxation, and then also the lengthening or the stretching of it. And so within our programmings, what we do is we start all the workouts with breathing drills. And this allows you to learn how to move your pelvic floor as your pregnancy is progressing because it's going to feel different. So first trimester pelvic floor movement is going to feel really different to third trimester pelvic floor movement where there's so much more loading and just stuff going on with our pelvic floors at that point. So we want to learn how to move the pelvic floor. We can do that with breath. So inhales to move the pelvic floor down to feel it stretch. And then exhales can be relaxation or exhales can be lift up and in depending on the demand. When we're doing pelvic floor relaxation movements, we also want to do it in different hip positions because different hip positions are going to influence different pelvic positions and the pelvic floor attaches to the pelvis. And so we need to do more than just deep squats and butterfly poses when we're doing these pelvic floor relaxation exercises. We also need internal rotation. With the knees in, ankles out. We also need asymmetrical type movement because the pelvic floor has asymmetry. And so there's different quadrants within the pelvic floor that are tighter than others. It's not just front half, back half. It's also like left back half that tends to be a little bit tighter. So really what we should be doing to help prepare our pelvic floor is focusing a little bit more on the internal rotation side to release that back half of the pelvic floor, which tends to be tighter for a lot of us. Not just deep squats and butterfly pose for pelvic floor relaxation. We also need like hero's pose or our knees in, ankles out pose or a 90-90 position breathing drill. And If anyone follows our Instagram, we've already posted like all of these example exercises as well. If you're like, I have no idea what that means. Then we also have tons of blogs that have, if you just type in pelvic floor relaxation, you'll see a bunch of different movements that are more than just external rotation. And then the last thing I would say for your prenatal workouts is supporting your prenatal comfort. So pelvic girdle pain is not mandatory during pregnancy, nor is like low back pain. Being in pain is not like a requirement of pregnancy. I know during my first pregnancy, I had some SI joint pain and I brought it up to my provider and they said, hey, when you give birth, it'll go away. And that was like the only solution I was given. And this was even something that like Roxanne believed before I was like, actually, no, like there's a whole lot of research out there that supports that there's things that we can do. And so ensuring that your prenatal programming includes things that are going to help support your comfort is also really important. So for us, we found that focusing on pelvic asymmetry, so the fact that your pelvis sits a little asymmetrical, can really influence your pelvic girdle function, in addition to the myofascial slings, which are these muscular slings that cross like your body. So you've got like an X on the front and X on the back, and they both cross right around those pelvic joints, and they help support those pelvic joints during movement. And so during pregnancy, we have a little bit more laxity and there's a little bit more movement happening within the joints. And again, it's pretty minimal movement. It's not like your shoulder joint and your SI joint all of a sudden. It's very minimal movement, but it's more than usual. And if the muscular sling that supports that joint that's supposed to help it close on itself during movement is not coordinated with itself, or maybe there's weakness along it, there's going to be too much movement that is happening, which can cause that pain. And so we found by focusing on how we're setting up our pelvic position, and then ensuring that the muscles that support that pelvic joint are coordinated has really helped lots of folks feel so much more comfortable throughout their pregnancies and can really influence so much more. Because if you're having tons of pelvic girdle pain, lots of labor positions are going to be pretty painful too. And so it's not only going to support being comfortable during pregnancy, but also support how you're going to navigate your birth. So top 3 things that I would say to ensure in your prenatal programs to support your birth is 1, make sure that you're moving in lots of different ways and that you're doing more than just lots of squats. Like we need not only external rotation or those squat type movements, we also need internal rotation, and we need asymmetrical type movements, particularly the movements that are focusing on internal rotation, because during pregnancy and even during life, everything is very external and extended. So we're in this very like open position. Well, we really need to be finding ways to open the lower half of the pelvis, which are some things that can really contribute towards labor stalls as well. When we're preparing our pelvic floor, ensuring that we can both lengthen and shorten it, but lengthen and relax are probably the most important when it comes to birth. And a lot of us tend to live in a very shortened state. So focusing on moving your pelvic floor can be really helpful. If you're feeling unsure on how to even do that, or if you're doing it correctly, you can also see a pelvic floor physical therapist throughout your pregnancy, and they can let you know, yes, this is when you feel this means your pelvic floor is lengthening. So they can kind of help you with that mind-body connection as things are feeling really different throughout your pregnancy. And then the last thing, again, is going to be ensuring that you're comfortable throughout your pregnancy. You don't have to be in pain. And if you're being told that you're just going to, this pain's go away after you give birth, then you need to find somebody else to support you, because you do not need to be in pain throughout your pregnancy.
And I love how your YouTube channel, which you also have in addition to Instagram, has a lot of shorts and a lot of videos like demonstrating a lot of these different strategies, like the asymmetrical movement, the different hip movements, the thoracic spine movements, pelvic floor. And I saw you even have a video on SPD pain for where people have pain near the pubic bone. And I think what you're saying is spot on, because my personal experience as well in the medical system is when you complain of different pain, whether it's hip or back or pelvic or pubic bone, a lot of times the response you get from your OBGYN is just like, well, that's just what pregnancy does to you. But what you're saying is there's actually exercises we can do to help relieve pain.
Absolutely. You do not need to be in pain during your pregnancy. There's a lot that we can do to help be comfortable throughout our pregnancies.
Yeah. So tell me a little bit, you've mentioned using Instagram, like what have been the most successful or ways that are, your most popular videos? Like how are people finding you, and what are they finding most useful on your social media channels?
So on our Instagram, we kind of think about the questions that we get a lot from folks, and then also introducing important topics that are maybe not well talked about. So like the video that helped us go viral, like we got 100 likes on it. We were super excited. And like back in like 2019 was I put the white dots on my sits bones, and then I showed how internal rotation like visually opens the bottom of the pelvis. And so we do a lot of visuals like that because it really helps folks like see and understand like, oh, this is how my pelvis moves when I do this movement. And so we have lots of props. I'm a real big visual learner. I'm also a really kinetic learner where I learn by doing things. And so we're trying to show things to people so that they can go try it in their own bodies and feel it for themselves. So those videos tend to be probably our most popular is these are exercises to do, kind of like quick tips of like things you could action right now. And then we'll link you to a blog that has like way more in-depth information on like why this is really helpful, because it's important to not only understand like what to do, but also like why we're doing it, because then you can apply it to other things in your life too, as opposed to like always needing to come to us for what to do. Like it empowers you to kind of know how to apply it yourself without constantly having to go to somebody else to ask for the answers. And I think that probably contributes to more confidence, like as we navigate like parenthood, motherhood, because we're always like looking for other people to give us the answers. But when we understand like why those are the answers, we can then kind of create our own. Hopefully that makes sense. And Instagram has been super cool with being able to connect with so many people too, like in a really similar phase of life to us, like personally. So like I had a ton of people that were due around the same time as me last year for my pregnancy and my birth. And so it kind of created this little community, and we had folks that were like messaging us throughout their pregnancies, and we kind of created these little relationships with people. And then you get to connect with so many other professionals that are in like the same like field as you and like learn from each other, which has been really cool. And then as professionals, able to share our information and our knowledge to so many people like so quickly is also like super cool, because I don't have to keep all these great ideas to myself or only be able to support the folks in my local community or my in-person clients. Like I can share this information with people like in other countries, and then they can go and have more comfortable pregnancies, like feel more confident as they navigate their pregnancies and their birth, and then feel stronger as they navigate postpartum. So social media has been like really cool for us.
And Roxanne, you mentioned you're pregnant right now. So do you feel like, you're living this in addition to teaching it? Like what's been most helpful for you with this particular pregnancy in terms of exercise?
In terms of exercise, I mean, I always get really bad SPD pain at some point during my pregnancy. But like my first one, it was like terrible because I was working full time. I didn't have the time to really work out as much. And then Gina was also kind of like tweaking the program still to kind of develop the pelvic stability program. So it's kind of cool to be able to compare each subsequent pregnancy that I've had to that one. Because that one, it was like 20 weeks. I was like debilitating pelvic pain. I had to like wear braces or like walk around with a ball to just like help the pain go away. And then with my second pregnancy, now this pregnancy, I'm really more proactive to be able to like strengthen the things that I do have imbalances. And then I think it's also important to know, like, we do share like, hey, we do have pelvic pain too. Like Gina and Roxanne also had some pelvic pain during pregnancy. It is common, but it doesn't have to be normal. And you can do things to prevent it from getting bad. And I think that with these two past pregnancies, to include this one, I even start feeling it a little bit, and I'll just do some like pelvic stability work really quickly that day and I'll feel better. So it's really cool to be able to apply all of the knowledge that Gina has about that pelvis and like being able to treat that pelvic pain in a way that's like more, I guess, experience and hands-on kind of knowledge versus just being like reading it from a textbook to be like, yeah, this is what this book tells me to do. Just being able to like actually do it.
It's definitely been a really cool part of my pregnancies as well. Is my first one, Mamaste Fit was not created. I just kind of was making it up as I went. And then for my second pregnancy, I had more knowledge, more understanding of pelvic like stability exercises to do, more understanding of like how the pelvis moved and incorporating those movements. And then during my labor, it was really cool to like understand what was happening, because it was my first labor after creating Mamaste Fit and gaining all of this new knowledge about birth and on prenatal fitness. So like I could feel different things and different sensations in my body, and I could feel myself moving in specific ways to intuitively create that space, which was something that I observed with my doula clients. Like towards the beginning, was someone would move in this one particular way that was including all of the movement patterns of opening the top of the pelvis, and they would get a cervical exam, and baby's station or how high or low baby was within the pelvis like matched their movement pattern. And it was like a really cool like observation for me that really connected a lot of the dots. And so in my own labor, I finally got to experience it for myself, where I was like, oh, I'm really swaying side to side because my baby's engaged, my baby's rotating, and I could feel myself moving in a specific way. And then for this last pregnancy, like with even more knowledge and understanding, like incorporating even more of that internal rotation work to open the lower half of the pelvis, I think really made a big difference in my third birth as well. And I just feel more and more connected with my experiences the more and more that I learn. And it's cool to like experience it for myself and then be able to kind of share like a deeper understanding of it to others.
Yeah, there's something about that. Experiencing it physically while you've been developing. That's so cool that you're able to incorporate that into your program. And you mentioned connecting with your pelvic floor. And we do have a podcast from February 2023, episode 256 with Sarah Duvall, all about just finding that connection with your pelvic floor. So I want to encourage our listeners to check that out. But in terms of your projects, do you have anything coming up you want to share with our listeners, or how can people follow you and support your work?
So for us, the next projects that we have is creating like postpartum support courses. So we're definitely really heavy on the prenatal and the birth side. And we are a little bit more lacking in the postpartum aspect of things. Like we have all our postpartum fitness programs, which seems to be kind of where we start with everything with the fitness. So we're creating some postpartum preparation courses, some newborn courses, so that our folks can have that full spectrum support throughout their pregnancies, their birth, and into that postpartum period.
That's awesome. And you are on Instagram at Mamastefit, and your website is mamastefit.com, spelled MAMASTE. Are there any other ways people can follow you?
So yeah, Instagram, we do have a Facebook page, we have a YouTube channel, and then our website as well. So those are all the ways that people connect with us. There are ways to email us. We answer all of our DMs, so happy to connect with folks through our DMs as well.
That's awesome.
We love hearing stories and just feedback from all of our followers, and or answering any questions they have via DMs or emails. That's one of the things that kind of brings us joy.
That's awesome. Well, Gina and Roxanne, it's so nice meeting two sisters who are doing this work together and making such an impact on pregnant people around the world. So thank you so much for coming on the podcast and sharing this info with our listeners.
Thank you so much for having us. We're definitely really excited.
We love evidence-based birth. We share it with everyone too.
All right, everyone. Thank you so much for joining us today as we listen to Gina and Roxanne of Mamaste Fit talk about the importance of exercise during pregnancy and share some of their best tips. And I hope you enjoyed their sister story and birth stories as much as I did. Thanks, everyone. We'll see you next week. Bye.
This podcast episode was brought to you by the Evidence-Based Birth Childbirth class. This is Rebecca speaking. When I walked into the hospital to have my first baby, I had no idea what I was getting myself into. Since then, I've met countless parents who felt that they too were unprepared for the birth process and navigating the healthcare system. The next time I had a baby, I learned that in order to have the most empowering birth possible, I needed to learn the evidence on childbirth practices. We are now offering the Evidence-Based Birth Childbirth class totally online. In your class, you will work with an instructor who will skillfully mentor you and your partner in evidence